Okay, so thank you for inviting non-mood member community, and I have no data to present to you. And my talk will focus on mainly more on relationships between science, society, and decision makers than on modeling, as we have heard. Yesterday, Thierry Lefrançois presented a French committee called COVAS, in French, Comité de veille et d'anticipation des risques sanitaires. I'm a member of this committee. I'm a medical entomologist by training. And in this committee, I'm more interested in vector-borne diseases. Sorry. Yeah. And this French committee is trying to anticipate and help in managing of diseases, infectious diseases. And regarding vector-borne diseases in France, but it is a bit the same in other European countries, we have a lot of vector-borne diseases. France, it is not only mainland France in Europe, it is also overseas regions in Indian Ocean, in Caribbean, and in the Pacific. So it explains a bit why we have so many vector-borne diseases transmitted by mosquitoes, like dengue, of course, but also Rift Valley fever in Indian Ocean, in Mayotte, West Nile, we have seen that. Malaria, we have malaria, autochthonous malaria in France, in Mayotte and in French Guyana. But also Oropush, it is on the table recently. It was on the table recently. It is a virus from South America, transmitted by culicoides, and we still have in French Guyana typhus, rickettsiosis, and diseases transmitted by ticks, also in France and overseas department. So we have plenty of such diseases, but some of these diseases are more important than others, and it is what I want to talk about today. Of course, we are all concerned by Aedes albopictis, the tiger mosquitoes, and the diseases and the viruses, transmitted by the mosquito. Dengue, Zika, chikungunya. We have seen this slide yesterday and this morning with the data from this year. So we are facing a huge increase of autochthonous cases of dengue in Europe and in France. There are many reasons for that, but one reason is imported cases from overseas. Second reason is the spreading of Aedes albopictis, and very probably the third reason is climate change. We also have an increase of West Nile virus transmission in Europe, and it is fairly recent in mainland France. But this year and last year, we were facing around 50 cases, human cases, 40, 50 human cases, also cases in horses and in birds a lot, but we don't know exactly how many cases in birds. So it is something we are very concerned with. Tick diseases, you all know that there is a new concern in Europe and in France with spreading of Yaloma marginatum tick, which is a potential vector of the CTHF, Crimean Congo hemorrhagic fever virus. It was the case in Spain with another Yaloma species and also Yaloma marginatum. And it is very probably the case in France, mainland France, but we have no human cases yet. But we have a lot of evidence, serological evidence of huge transmission of CTHF in the south of France. But also the virus has been isolated in 155 horses and cattle, ticks from cattle and horses in Pyrénées-Orientales. Pyrénées-Orientales is close to the Spain border. So that means the virus is still there, the ticks is there, and so the risk for having human cases, CTHF human cases, is just increasing in France, like in Spain, and probably in other countries in the future. Something I want to talk about, it has been mentioned yesterday, is for trying to manage or to do something with climate change, many cities in Europe are trying to develop vegetation and to green the cities. And we have to do that. Definitely, we have to green the cities. It is very important for many different reasons. I have no time for developing here. But we have also to take into account the risk for increasing biodiversity in greening the cities. Biodiversity, it is host, like birds and rodents, but also vectors. So we will have more vectors greening the cities, and these vectors can transmit some pathogens. For example, in urban park or urban agriculture, rain gardens and green corridors, we may have more Culex pipiens, tiger mosquito, anopheline mosquitoes, and ticks, of course. So we have to really consider that. But vector-borne diseases and vectors, it is not only a public health issue. It is also environmental issues, environmental in terms of biodiversity, but also in trying to control the vectors, for example, using insecticides. Economic issues, of course. There was a recent paper this year on the cost of mosquitoes, disease, patients, and control. So mosquitoes are very expensive. Social and political issues, of course, and training issues. It is important for governments to think about this. Train not only students, but train also elected representatives, decision makers, and citizens, of course. And research issues, of course, we are researchers here in this room. So it is the reason why the French government decided to create what Thierry presented yesterday, the COVARS. It has been created 2 years ago by the Prime Minister. And the objective of this committee, COVARS committee, again, mainly focused on infectious diseases, is to give advice, recommendations to Ministry of Health, Ministry of Research, and other ministries. So we are 20 members with complementary skills in this committee. And what we have done, we have written many different reports. It is not the 20 people writing the reports. So we have a lot of auditions and reading other reports in different countries in the world, WHO, EU, Italy for West Nile, for example, and Czech. So we have written some reports, 4 reports on vector-borne diseases and vector control, a general one on vector-borne diseases. It is available on the website of the Ministry of Health and the Ministry of Research in France, but it is in French. And a report on dengue, Zika, chikungunya, another one on West Nile fever, and what Thierry presented yesterday, a report on risk assessment of major health situations in the next 5 years. And I will explain a bit what we have done in the diseases identified at risk for France. There are many vector-borne diseases. You have the list here from plague, it is in French again, from plague to CTHF, dengue, West Nile, malaria, Lyme disease, and so on. And so we have evaluated different risks, not only public health risk, but also epidemiological risk. That means occurrence, emergence, outbreaks, and expansion, clinical risk, morbidity, mortality, sequelae, etc. If we have prevention and control measures available, what are the tools? What are the strategic plans? We are supposed to have a strategic plan in France for dengue, Zika, chikungunya. Nothing regarding West Niles, nothing regarding ticks diseases. So, and also, if there is such plan, what is the efficacy of these plants? What is the efficiency? For example, if we recommend to use insecticides, what is the level of insecticide resistance of Aedes albopictus or other mosquitoes, Culex pipiens, for example? And of course, what are the impacts? Impacts, it is a lot of things, but it is impacts on healthcare system, psychosocial impacts, economical impacts, and again, it is important, environmental impacts. So there are many, many different variables, and it is not easy to modelize all these things, but at least you can put rank, you can give a note to all these parameters from very high risk in red up to negligible in blue. And then the committee recommend to focus mainly on, or a bit more on dengue, West Nile, and Lyme disease, plus on the right, as you can see, because the risk has been considered as very high. A bit less, but orange, Zika, chikungunya, Crimean Congo hemorrhagic fever, and less tick-borne encephalitis. Again, there is a vaccine, for example, for tick-borne encephalitis, yellow fever. We still have yellow fever in France, in French Guiana, but there is a very good vaccine. Uzutu, yellow, it is less. So it is the same presentation, but it is not a table. So on the right up, it is the risk, the consequences, and the probability of occurrence is higher. So it is very high for West Nile, for dengue, but of course it is very high for influenza, for acute respiratory infection, as you can see on the right, the far right. But vector-borne diseases are in the red or orange boxes. So it is, the risk has been considered as high or very high. So what can we do with this? We made this report to the ministers, but now, so what? Who makes what and what for? From surveillance, reporting, analysis, actions, and evaluations. For example, who is in charge of surveillance and monitoring of infectious disease? Why doing such a surveillance? It is not a naive question. Sometimes it is not necessary to have surveillance, but sometimes it is. So which diseases, how to do that, who will make the surveillance? Same for vector surveillance. Why, which vectors? Only the tiger mosquito, also Culex pipiens, or we have 65 mosquito species in mainland France. So do we have to survey all the 65 or only focusing on 2 or 3? Same for transmission and same for evaluation. Evaluation is something very important, but not already very well done. So efficacy, efficiency, impacts, who will do that? And in France, we have plenty of bodies who are supposed to do that. But I'm very sure it is almost the same in all European countries, including UK. Of course, we have the bodies from the Ministry of Health. At the national level, General Direction of Health, ANSES, Santé Publique France. Santé Publique France should be a bit like Instituto di Sanità. We have bodies and the partners at the regional level, regional health agencies, local authorities in municipalities, it's fine. Vector control operators, because the state asks to the region to do something, and the region has to operators to do something. And researchers in the middle say, oh yes, it is good or not good. So it is a bit complicated. But also we have some other ministries, agriculture, environment, research, interior. So the situation in France, it is very complicated. It is marginalized. And the COVARS made several recommendations. And I'm very sure that these recommendations could be useful also for other European countries and also for ECDC. We have to clarify the role of the different players in vector control. There is a law, a decree, in France codifying vector control in France. But there are different roles of states and municipalities. The tiger mosquito, when it transmits the virus, dengue virus, it is a state. But it is just biting you. It is not the state. It is the municipalities. But it is the same mosquito at the same place at the same time. So who is paying? So we recommended, the COVARS recommended to create a structure for talking, exchanges, and communicate between many different players, vector control operators, municipalities, researchers, agencies, and so on. Also produce a guide for best practices for the state and also for local authorities and citizens. Of course, taking into account climate change component, environmental change, etc. Have a common database. We have plenty of data in as many databases as bodies. So it is a big problem if we want to have a kind of synthesis. Develop research, develop citizen actions, and collaborate, of course, at the European level. So that's all. It is just a kind of optimistic or pessimistic visions of what we are doing in France and what we have recommended for being as good as possible, better if possible. And as you can see, the tiger mosquito, it is very, very beautiful species. And control of these species, we have to manage very carefully.